Hi, good afternoon, everyone. It's great to have so many of you joining us today, and I know people are still coming in from the waiting room. For those of you who haven't joined one of these calls before and may not know me, I'm Emily Beauregard. I'm the director of Kentucky Voices for Health and a member of the Thrive Kentucky campaign. Happy fall break. If this is your fall break, we know people are probably trying to wrap things up in order to do something fun for a few days. I had to miss last month's policy update and forum with the Kentucky Housing Corporation, but I know that it overlapped with the first day of an incredibly fast-paced and disappointing special session. So we have a lot to catch up on today. Dr. Schuster is going to be giving us that update, but I did want to take this opportunity to just quickly say thank you to everyone who helped us collect sign-ons for the letter that we sent to legislators with our recommendations for protecting the health of Kentuckians and supporting a strong and equitable recovery during the special session. We had 77 organizations altogether that signed on to our letter. And while it seemed like there was really no opportunity for public input during the session, that broad support that we were able to demonstrate for just and sensible policies did not go unnoticed in Frankfurt. So thank you for helping us with that. I'm going to click ahead of my slides here. By now, most of you are familiar with Thrive Kentucky, but for those of you who may just be joining us for the first time, our core purpose is to meet the basic needs of every Kentuckian through systemic change. And this is because we recognize that many of our fellow Kentuckians face historical and systemic barriers to meeting their basic needs. And for that reason, we believe that the only way for all Kentuckians to thrive is through anti-racist and anti-poverty policies that will lead to a more equitable and just Commonwealth. You can see our shared principles on this slide. And here are the members of Thrive Kentucky. And I wanted to briefly thank our 2021 sponsors, Aetna, Humana, and United Healthcare. Their support for this series of webinars helps us to keep it free and make sure that we can bring you this content every month. So we appreciate that support. We also provide CEUs for certified community health workers and licensed social workers and are able to do that for free as well. So if that's you and you want to get credit for this, make sure to contact Kelly or myself after this and we'll get you a certificate. So here is the agenda for today. As always, we cover a lot in these 90 minutes. We really want these webinars to be an opportunity for you to get the latest information on the state and federal policy landscape, hear updates on our safety net programs, share feedback and ask questions. So during each section as we go, please just be sure to put questions or comments you have in the chat. We'll cover those as we go. We find that works better. And if we have more questions than we can get to in the next 30 or next 90 minutes, we'll make sure to send you written answers in our follow-up email. And we do send a follow-up typically the day after with the recording, with anything from the chat, and any of the materials that we share. So before we begin, just some quick housekeeping. We have a lot of folks on the webinar today. Be sure to mute your line. We are recording this webinar. We'll be sending it out, as I mentioned, with any other materials, also an evaluation that we'd really like for you to complete so that we have a better idea of what to cover in future webinars. And like I said, if you're a certified CHW or a licensed social worker and you'd like to receive credit, be sure to contact us. And with that, I'm going to hand it over to Dr. Schuster to get us started with a recap of the special session.
Thanks very much, Emily, and good afternoon to you all. I'm Sheila Schuster. I'm the Executive Director of Advocacy Action Network, which is the Mental Health Coalition and the 874K Disabilities Coalition. Next slide, please, Kelly. So if you blinked, you missed the special session. This was a very unique session. It went from Tuesday to Thursday, actually right up to midnight on September 9th. It was notable in several respects. It was one of the shortest in the history of special sessions. I think back in Governor Brereton Jones' days in the 1990s, there was a special session that he called and the legislators came in and adjourned the special session the first day. but obviously they didn't do any business. This is the shortest one that has resulted in any enacted legislation. It used to be that it took 5 days to get bills through both the House and the Senate and over to the governor's desk, but they have found some shortcuts that allow them to do it much more quickly, which is not always good, I think, for the democratic process. It's only the first special session in history where the governor who called it, and you all may remember that only the governor could call a special session, and the governor in his call outlines narrowly or very broadly what he wants to be discussed in the special session. So Governor Beshear called this special session, and he had certain asks of the legislature. He ended up vetoing 2 of the bills, Senate Bill 1 and Senate Bill 2. First time in history that that's happened. But then those bills were overridden by the majority Republicans in both the House and the Senate. It was an ugly session. I've been going to Frankfurt since 1978. I've watched all the special sessions or been up there. There was probably more yelling, more name calling, more just angriness throughout the session. And I think that doesn't bode well for the way that our democracy should be operating. And it was the only one that anyone that I talked to in history where legislators were calling on the governor to actually amend, excuse me, to amend the call for the session while the session was in progress. So on the last day of the session, there were several Republican senators who were standing on the floor of the Senate, literally yelling for the governor to come to the floor of the Senate and to change his call, which he did not do. So it was notable, as you can tell, not very much in positive ways. Next slide, please. So, whoops, looks like our spacing got a little messed up. But anyway, these were the things that were on the call. So I marked by them whether the session accomplished that or not. So one of the things the governor wanted was to extend the COVID state of emergency until January 15th of 2022, and they did do that. He wanted to keep in effect all of his emergency orders, the ones that came from the cabinet and other agencies, and also from some of the licensure boards until the end of the state of emergency. And that did not happen. They actually took away all of the emergency orders that the governor had issued and that the cabinet and agencies had issued. They did keep some of the licensure board orders, which allowed more reciprocity, allowed healthcare providers to be able to practice without some of the restrictions that would otherwise be in place. He wanted them to set out criteria under which he could require facial coverings or masks, and they clearly did not do that. In fact, they essentially did away with all mask mandates. He wanted additional flexibility for school districts to extend alternatives to in-person instruction. The non-traditional instruction, that's the NTI, was limited to 10 days. And I think the governor and many others wanted them to give the school districts more of those days in case they had COVID outbreaks. That's not exactly what happened. He wanted additional sick days and funding stability. Funding for the schools is based on attendance. So if the schools are hit hard by COVID and many students are in quarantine and can't come, it affects their funding. And they did address that. And he wanted retired and student teachers to be able to offer instruction, and they did address the retired teachers. He also wanted to appropriate $69 million from the American Rescue Plan Act, that's ARPA, for COVID-19 related expenses, and that's continued testing, contact tracing, PPE, and communication, and they did do that. And he wanted $2 billion set aside for economic development and to extend the state of emergency for Nicholas County, which was undergoing a flood emergency. You all have undoubtedly heard about the big announcement in Glendale, Kentucky, where Ford is opening up hundreds of jobs and investing billions of dollars. And $400 million that was an incentive came from this $2 billion that were invested. So that was certainly a great investment. Next slide, please, Kelly. Thank you. So the governor's emergency executive orders are ended after 30 days, and his ability to issue moratoriums on evictions and utility shutoffs. And these really affect people. We're going to hear later about evictions and housing issues. They immediately ended the mask mandates for all schools and daycare centers. And this, I think, caught everybody off guard. They actually passed a bill that said they cannot do any mask mandates across the state until June of 2023. So they're going to be back in session in January of 2022. And I think they really, if we still have the kinds of outbreaks that we're having around the Delta variant, I think they're going to have to look at this. They did leave it up to the local school districts, and I think they assumed that the local school districts would not put mask mandates in place. But thankfully, 96% of the school districts did keep a mask mandate, and the others had some form of a partial mandate. They limited the Cabinet for Health and Family Services regulatory power to address contagious and infectious diseases. They're forcing the nursing homes to allow visitors, no matter what the pandemic numbers are. And I happen to have a loved one in a nursing home, and it's been very hard during COVID not to be able to visit my family member, but I want that family member to be safe. So I want to bow to the expertise of the nursing home. So as much as I want to be able to visit, I think this is poor public policy, certainly poor public health policy. They did keep the reciprocity and licensure loosening of those requirements to expand workforce capacity. They also put visitation for non-custodial parental and fictive kin to go back to pre-pandemic conditions. And again, I can see that from the child's point of view, to be able to visit all the adults in their life. But again, with people not being fully vaccinated, I think it puts kids at risk, particularly those young kids who cannot be vaccinated at this point. Next, Kelly. And this is my last slide coming up. So I think that this is not democracy. This is not the way it's supposed to work. Emily mentioned, and we thank you all, 77 organizations signed on to our letter. There were a number of letters that came from healthcare groups. There was one that came from the Kentucky Hospital Association, joined by the Kentucky Medical and Kentucky Nurses Association. There was ours. There were a number of letters, Kentucky Nonprofit Network, all urging some public health measures and so forth, many of which were not implemented. The speed with which the measures were brought forth made it almost impossible, even if you were there, and public participation was limited. There were committee meetings that were called with only literally a few minutes notice, making it nearly impossible for even the legislators to be involved, much less the public. And I think the outcome is that the power struggle between the Republican legislators and the governor and executive branch will continue. I think we're seeing it now. There's been a call for another special session by some of the Republican legislators. They want millions of dollars poured into the hospitals and nursing homes. And the governor has been very resistant to just doing that, although he made an announcement yesterday that sounds like he's identified funds that will go to a number of frontline responders during the COVID time. So that's the wrap up of the special session. I think it was ugly from start to finish. I think most of us disagreed with many of the policy decisions that were made, and certainly disagreed with the process by which it was done. So I'm going to be negative about it, unfortunately. I'm happy to turn it over now to Kara Stewart to tell us about ARPA and child tax credits. Thank you.
I feel like Dr. Schuster was just setting me up with the ugly session talk, because I actually have good news. So it's I don't know. I feel like I need a transition period from what was ugly about that into what is actually possible and happening now. So the American Rescue Plan, of course, was the first part of Build Back Better. So Build Back Better is what's happening from the federal government, from the Biden administration, to do big things under lowering costs for families, like lowering childcare costs, higher education costs, prescription drug costs, healthcare costs, housing costs, cutting taxes for families with children, like cutting taxes for families without children, but not cutting taxes for the super wealthy, creating jobs by funding workforce training and clean energy jobs, which of course we just heard some about, some of that's getting ready to happen in Kentucky, and investing in teachers and schools. You can go to the next slide. So that is the part that has already happened. That American Rescue Plan, that became law in March, that was signed through the reconciliation process, which of course is a strange thing that exists because of the filibuster. So it's a strange thing that exists in both the House and the Senate. It's just not relevant in the House. So in the Senate, you have to have 60 votes. And if you don't, this is one of the ways you can pass a bill through reconciliation. And so the American Rescue Plans, we already have a lot of those monies sent out. There are still more to go. So that will still be on the table come January when we have our next session. So that will still be out there. We can go to the next slide. And then this, I hope there are people on this call, I hope, who have received their monthly child tax credit. So child tax credits started, feel free to celebrate and raise your hand, the goodness of government there. Dustin Pugel's hand went up, that if you've got children, then are on around the 15th of each month, then you can get part of your child tax credit, the first half of it fronted to you monthly, which is a much more rational way to deliver those funds, because a lot of times people need cash flow help, not just help, in January or February. So, and then you have until basically the first Thursday of each month to say, I don't want my advance payment this time. But it is an incredibly tiny percentage of people where it makes sense to do that. That would be, you'd have to be in a situation where your income is significantly higher in 2021 than it was in 2020. And that you are worried about the balance not being enough to cover your allotment, which again is going to be a tiny little bit of people. So I would not worry about that. But it is, you can every month, you have the choice to go to the portal. You can go to the next slide, the portal where you can choose to opt out. But this is sort of more celebration here about what is already happening in Kentucky. So we have already seen nearly 70,000 Kentucky children be directly affected. We've already seen this is literally raising children out of poverty, and we can make it permanent. So right now, this is on the table in lots of different bills and places, but as a part of the Build Back Better plan, there are 2 bills that have not yet become law as a part of Build Back Better. I'm sure you all heard about this in the federal news. So there's the 3 bills total, and the second and third one, and one of them includes making the child tax credit go until 2025. So not quite permanent, but a lot closer. And otherwise it cuts off after just this 1 year. And it's been such a game changer for Kentucky families that I hope that we are able to get that over the finish line and stay. So yeah, going to the next slide. So this is the portal where you can manage your payments and find out where they are, what's going on. It is not as user-friendly as we would like, but it exists. It's not yet, it doesn't yet have the option that was promised on the calendar on the next slide that says that you're going to be able to, by late summer, make changes to your dependents. That even though it is now October, and I think anyone would consider that post late summer, perhaps even fall, the IRS has not yet updated to make that possible, but they say it is still coming. And if you go to their website as of today, this is the timeline they still say is happening. So they've got a different kind of seasonal calendar than we do apparently, but I do believe that it is still coming. And again, it's the 15th or so approximately of each month when people should be seeing those that hit their deposits, hit their accounts. So the next slide. All right, so we've already talked about this a little bit, but what is going on in Washington, D.C.? Next slide. The American Jobs Plan and the American Families Plan. So those are parts 2 and 3 that all go together to Build Back Better, which is again the White House's plan for American policy. And you can see, how we got here to this point, but right now we've still got question marks. The reason we still have question marks is because one of these bills has already passed the Senate with overwhelming support, but there's a little bit of a holdup on the House side, which isn't normal. Like that's not the way we normally are used to seeing that. I'm missing my speaker notes there. I was going to give you the exact vote count. Now I'm not. Or you can go to the next slide. I think it was 69-31. It was 69-31. And look at that. I put it on this slide, lest I could not find those speaker notes. So we're now in limbo with 2 and 3. So 2 passed the Senate and is like an easy bipartisan, roads and bridges bill. But that needs to be passed with 3, which has what we need for Kentucky families. So what we need for Kentucky families is in a lot of that is in that number 3, the fighting hunger among children that builds on the success of the PEBT program. That's in number 3. Making healthcare affordable and taking the recent enhancements from ARPA that allow very low wage workers to purchase premium free plans in the marketplace and expands eligibility for human tax credits. That's all in number 3. To help Medicare benefits for older Kentuckians. It's nearly 1 million Kentuckians with Medicare would begin receiving vision, hearing, and dental benefits. Think what a game changer that is. First off, how insulting is it that we do not provide vision, hearing, and dental benefits to older Kentuckians? But that number 3 would make that be true. That would be starting in different years. It wouldn't all start at once, but they've never been included in Medicare coverage before. So it'd be a big deal. There's also a lot in that number 3 for expanding home and community-based services. We've got around 30,000 Kentuckians receiving long-term services in their homes, the community rather than the nursing home. And this increases the federal government share for home and community-based services by 7 percentage points for the next 10 years. But what we need to know is it makes it better and more reasonable for people to be able to have better quality of lives in their home where they need to be, which costs less than in nursing homes. It also makes community college tuition free, establishes a paid family medical leave program, creates universal preschool, and makes childcare more affordable. It's a really good bill. So the takeaway here, very good bill. We need this bill. It is currently, I put currently in italics because the currently 3.5 trillion, if you all listen to NPR in the morning like I do, you'll know that this number is getting squished around lots of different ways because there's a lot of politics happening around it. But what I would say is what we can do is we can make a phone call and we can call and say, here are the things that we cannot negotiate on, that we have to have. Obviously, my dogs are very excited about Building Back Better. They are very excited about American Families Plan, even though I don't think there are any dog-specific benefits in the plan. They care a lot about Kentucky children. So I wanted to go ahead and put a couple for Kentucky Policy. They made a nice little graphic that just shouted out some of the incredibly high-end benefits for Kentuckians that are in this bill. So pick up a phone, make those phone calls, say, we got to have it, figure it out. The next one is, look at that. So good. So good. Actually good. And I think I'm finished, other than I would like some head shaking, nods, promises that you will make a phone call on your own time whenever you can. Appreciate you. Diane, thank you. And I think I am going to, you've got your reference slides built in here. And I'm going to hand it off to Dustin Pugel. See what news he's got today.
Oh, man. Well, first of all, thanks, Kara. I think that was a really good overview of what's at stake in these plans. I think, obviously, we would love to see the bipartisan infrastructure plan pass because we have some crumbling bridges up there in northern Kentucky and elsewhere. And we have a lot of need for sort of green infrastructure, and I think that would be really good. But really, the Build Back Better plan would be revolutionary in a lot of ways. And so even if it gets pared down, there's enough in there that I think we would see a really noticeable and meaningful difference for Kentucky families and kids. So I'm really eager for Congress to get to work and make that happen. And now we're going to shift to kind of what the economic situation is that this would help, because, as everyone knows, we are digging our way out of a really historically bad downturn that I think the Build Back Better plan would be incredibly meaningful in terms of putting us on a really solid footing for recovery in the United States and in Kentucky itself, both in terms of sort of the broad economy, but also in terms of people's actual livelihood. So we're going to go through a couple slides on this and then run through some updates on unemployment insurance before we move on. So the first slide, I show this every month. This is basically just a snapshot of the total jobs picture. We are slowly but surely returning to the employment situation we saw before the pandemic hit. This last month was really good in Kentucky. We saw our first big uptick in about a year. And so our hope is that that will continue moving forward. We won't know for a few weeks until the jobs numbers for September come out. But we're still about 75,000 jobs shy of where we were in February of 2020, which is about 3.9% below pre-pandemic levels. At the same time, we've recovered about 3/4 of the jobs that we lost. They're moving between February and April of 2020. So, things are improving, but we're not there yet. And so these supports that we're going to talk about today, the benefits that would come from the Build Back Better plan and the infrastructure plan, those are all really badly needed to get us to a place where everyone has a well-paying job that provides good benefits, and that we provide the supports around those jobs so that folks can take advantage of them. Supports like paid leave, childcare, preschool, food assistance, and more. So let's go on the next slide. This is just a look at where we are by industry. The good news is that we have actually fully recovered, so to speak, in a few industries, specifically manufacturing, trade, transportation, utilities, and financial activities. The bad news is that we still haven't recovered in most industries. And so I think there's still a lot of room to cover. Specifically, I wanted to mention that leisure and hospitality, which is kind of what it sounds like, hotels, restaurants, entertainment venues, it's still lagging worse than most other industries. But at the same time, they've also brought back more jobs than any other industry, around 60,000. And there's a piece that just came out from the Federal Reserve Bank of St. Louis today that talked about leisure and hospitality specifically and had some Kentucky specific numbers, and essentially said that their recovery has been rapid. It has recovered quicker than in previous recessions, but the Delta variant recently has really slowed down that progress. So I think, one of the best solutions we can deploy right now is the same solution we've talked about for months now, which is to get vaccinated. Because as we slow down the spread of COVID, we can help industries that are especially susceptible to transmission of COVID, like restaurants, where by necessity you have to sit in close proximity without a mask on. And as the weather gets colder here in the coming months, that's going to become all the more important as outdoor seating is going to become more difficult. The other industry I just wanted to mention that has really not recovered well is government, and specifically local government. Folks will remember that last year in the CARES Act and in the December package, there was some funding that went specifically to large cities and state governments, but a lot of the smaller governments, like county governments and smaller city governments, were left out of that. And because of that, they've had to shed a lot of jobs. And so it's actually the only industry, government is the only industry or sector in our economy that's actually lost jobs since April of 2020. Now, there's a lot of money coming to local governments to help through ARPA. That money is sort of being decided on right now. I know folks in Lexington have seen news recently about the plan to spend that money. That process is happening in all 400 and some odd cities and all 120 county governments right now. So hopefully that trend will reverse as this relief money has started to really get deployed in those communities. So let's go to the next slide. Some updates on poverty in Kentucky. So unfortunately, last year, the American Community Survey, which is sort of our gold standard data source for poverty data, it did not get robust enough responses in order to be reliable. And so we are forever and always going to have an asterisk next to 2020 when it comes to our ACS data, because we just didn't get the responses that we needed to be able to have a robust data set to make good estimates around this. So instead, what the census has done is they've used national data with a different survey called the Current Population Survey, and showed that while income fell in 2020, as we might expect, the supplemental poverty measure actually also fell. Now, the supplemental poverty measure is different from the official poverty measure because the supplemental poverty measure includes all the types of programs we're going to talk about today. So it includes food assistance, medical assistance, cash assistance, and other types of help. And so what that says is that even though income fell, people did not slip into poverty because we were there to catch them with a really robust and powerful safety net during 2020. And I think that's really a testament to the value of the programs that we're going to talk about today. The Urban Institute actually synthesized some of this data and gave estimates as to what the supplemental poverty measure would be in Kentucky during 2021. So the following year, the year that we're currently in, with and without several of these programs, and found that about 700,000 fewer Kentuckians lived in poverty because of 11 what they call programs and supports through the federal government. And that is really an incredible, again, I think, indicator of how important these programs are to alleviate hardship, to ensure that our neighbors and loved ones are not living in poverty, and to reduce a lot of trauma that goes along with that. I know folks in this call care a lot about what are called adverse childhood experiences, which are situations that create long-lasting harm to folks, starting in childhood and throughout their life. Poverty is one of those. And so I think we really need to take stock of what these programs have meant for folks in the last 2 years, and to learn a lot of lessons from that when it comes to implementing new policies like those found in the Build Back Better program, plan, but also as the General Assembly meets next year and starts discussing things like food assistance, cash assistance, and unemployment insurance. So let's move on to the next slide. So just a quick couple updates on what's going on with unemployment insurance and jobless benefits in Kentucky. For those of you who have kept careful watch of this particular slide in the past, you'll notice that it's missing some numbers, specifically the numbers for pandemic unemployment assistance and pandemic emergency unemployment compensation. That is because those programs have ended in Kentucky. They ended on September 4th. And so around 35,000 people lost that income support overnight. Now where we are is we have just our traditional unemployment insurance program that replaces about 50% of wages that are lost when you become unemployed. And as of the most recent week that we have, September 11th, there are about 13,000 people receiving those benefits and about 3,500 people requesting benefits for the first time. That puts us about in line with where we were before the pandemic. So even though we haven't recovered the number of jobs that we had before the pandemic, we have returned to close to where we were prior to the pandemic in terms of people asking for help because they're unemployed. So let's move to the next slide. And just thinking about those federal jobless benefits that are now gone, and just taking stock about where we started and where we ended up, we have paid out just an incredible amount of money to folks. And this was actually one of the indicators that the Urban Institute used when determining how many fewer people were in poverty in 2020, these extra jobless benefits. So for example, 3.4 million benefit weeks were paid out between PUA and PEUC, the two federal programs. Benefit weeks are just, the number of people who used it per week multiplied by the number of weeks they were paid out. So that's a whole lot of assistance that went out the door to folks who were unemployed. That looked like $3.4 billion paid out in the extra weekly supplemental payments of $600 early on and then $300 later on. $500 million paid out in the Pandemic Emergency Unemployment Compensation Program. That's the program that goes to folks who need additional weeks of benefits. About $100 million paid out in pandemic unemployment assistance, which is the program for folks who either have COVID or have to quarantine due to COVID, or are independent contractors or small business owners. And then actually one program we haven't talked about a lot is $104 million paid out in temporary first week benefits. So in Kentucky, traditionally we, or at least since 2011, have not given people benefits during the first week that they are owed benefits. But thanks to early action on the federal government, they decided to step in and go ahead and pay that first week out anyways. So we've gotten about 104 million. So all told, that's about $5 billion in federal dollars that have come into Kentucky's economy. I've seen multiplier estimates, which basically just means how much more in economic activity is generated from that initial investment, of around 2, which means that we've had about $10 billion in economic activity thanks to these benefits, which has not only reduced hardship for the folks who have received the benefits, it's also kept other people in their jobs, which I think is important to remember. Okay, last slide for my section. Real quickly, there are several things that are happening in the state. First is there's a bill that has been filed by Representative Kulkarni and is being co-sponsored by Representative Heverin that gives unemployment insurance to people fleeing intimate partner violence, which includes domestic violence, sexual harassment, stalking, et cetera. KCADV and others are really helping to champion this bill, and it would really be helpful and would help Kentucky join 39 states, DC, Puerto Rico, and the Virgin Islands in having a policy that allows for this. So it's really a good bill that I hope that moves forward in the coming session. We're also getting a new computer system. We're nearing the end of an RFP process. Unfortunately, it's going to take about 2 years to build, and we're going to use money that we've set aside in the Unemployment Insurance Trust Fund to pay for it, around $47.5 million. There is a process for waiving overpayments that is going on right now, although there are issues with that that we can talk about later if we want. Too few people are getting those waivers, unfortunately. And then there is still an unemployment insurance reform task force that will continue through December and provide a report. Right now, the recommendations that they're offering or at least discussing are not very good in terms of workers. I'm worried that what we're going to end up seeing are measures that make it more difficult to use and qualify for unemployment insurance, measures that cut benefits, measures that make it to where it pushes people into jobs that they don't qualify for, or I'm sorry, that they are overqualified for too quickly, that are underpaying, and that cut the number of weeks that people are eligible. Those are the types of things that are being discussed. So just sort of a stay tuned red flag on the Unemployment Insurance Reform Task Force at the moment. Federal level discussions that are going on right now, Senators Wyden and Bennett have put forward something called the Unemployment Insurance Improvement Act, which is really just setting minimum level standards for states that administer UI benefits. It's a really good bill. There's some talk about maybe a last minute inclusion of it in the Build Back Better plan, although I think there's also a question about whether or not it would qualify under reconciliation because it doesn't expend federal benefits. But it is a really good bill that I hope moves forward because right now it's sort of it's sort of a little bit the Wild West in UI world in terms of what states are able to do in cutting benefits. So I will stop there and hand it over to Adrian.
Hi, everyone. It's Adrian Bush with the Homeless and Housing Coalition. Glad to be with you. Okay, so just a reminder, the CDC's order to halt evictions for non-payment of rent, unfortunately, was overturned by the US Supreme Court using the shadow docket in late August. And we can go back and forth about whether it was a good thing, a bad thing, but there is significant empirical evidence that the CDC's order and other state orders really did help many Americans and Kentuckians. Unfortunately, only a handful of states and cities still have overarching legal protections that disrupt the eviction process. Next slide. Okay, so as we've been monitoring this situation, I keep an eye out on the Metro United Way 211 calls, and you can see that the calls for housing and shelter, about a quarter of them remain for that. But rent assistance, excuse me, still remains really high, the need for that. And so I think for us, it's just a reminder that folks are not out of the woods yet. We still need to make sure that we're getting these resources deployed. Next slide. And then you can see where some of our hardest hit communities are in Jefferson County and some of those census precincts, and then even outside a little bit. Next slide. Okay, so a reminder, if you do need rental assistance or you have friends or family or colleagues or clients who need it, there are 3 places you can go. Louisville has a portal, Lexington has a portal, and the rest of Kentucky has the Healthy at Home Eviction Relief Fund. We're going to talk a little bit about that. Next slide. Okay, so if you were able to join us last month, you heard a great presentation and overview from Wendy Smith of Kentucky Housing Corporation about the housing provisions currently being deployed in Kentucky, and both currently and future. So right now, that left-hand column, the CRISA, the December COVID relief package, that is what we're using for emergency rental assistance through the Healthy at Home Eviction Relief Fund. Now, the American Rescue Plan Act comes with several other provisions, basically in 4 buckets. One is emergency rental assistance 2.0. The next is a homeowner assistance fund. The third is HOME, which is a federal program, the Home Investment Partnerships Program, specifically for homelessness. And then emergency housing choice vouchers, which are in the process of being deployed in all across Kentucky using local housing authorities. Next slide. Okay, so the rental assistance eligibility, it's essentially the same across all 3 jurisdictions, Louisville, Lexington, and what we call the balance of state. And so, but I did pull this from Kentucky Housing Corporation. So it's for folks who have arrears and they're under 80% of the area median income. You may think, I have no idea what 80% of the area median income is because normal people do not, but there is an eligibility checker on the website. And I will say that most people who are working retail jobs, hospitality, the folks who have been hardest hit by COVID-19 and its economic impact, you're most likely under 80% of the area median income. It covers back rent and it can cover forward rent. The maximum amount of assistance is over a year, 15 months. It also covers utilities because most apartments and homes for rent, utilities are separate. They are in the renter's name, not the landlord's name. And then finally, just a reminder that a third party can help to get these applications moving. And you can help your friends and family who need it. Next slide. Okay, so KHC has been providing some information around their spending month over month. Kentucky's programs actually opened up in February. This money was first authorized at the end of December, was made available at the end of January, and Kentucky was one of the first states to get their program started. So you can see they started making payments in March, significant increase from April, then a decline in May. Our high point has actually been in July. And so I want to make sure that we are continuing to try to get the word out because we still have $143 million available to help people with their rent, which is unprecedented in housing. Typically, the amount of emergency solutions grant funding for what we call the balance of state is about 2.5 million each year, just so you know. Next slide. Sometimes I get asked questions about the housing assistance or what we're doing for homeowners who have been impacted. And the answer is that Treasury, because of the American Rescue Plan Act, has made available $85 million to Kentucky to help homeowners who are behind. This is a process, unfortunately. So Kentucky Housing has submitted its request to the governor's office and the plan to Treasury, and it's a back and forth waiting on approval. The good news here is that foreclosures, delinquent mortgages, while they are incredibly painful, they take more time. In Kentucky, you can be evicted in a matter of 3 days. Not so if the bank holds a mortgage on your house. If you want to learn more information as that plan is rolled out, you can sign up on the link with the slides that Kelly will be sending out tomorrow. Next slide. Okay, before I go to this slide, I do want to answer Tyler's question. And it has come up that we do have property managers, landlords who have turned away free money. They don't want landlord relief, which is what emergency rental assistance is. So then the question becomes, can people who qualify for the program, but their landlord won't take it, can they get the money directly? And the answer is yes. And they can use it for another home with someone who will accept the money. So just on the KHC website, there is a customer service line. The other thing too is that there is a timeline. Once the app, if a renter starts the application, Kentucky Housing Corporation receives it, that starts the clock ticking. Like the landlord has 5 to 7 days. I think it's 5 now, might be 7. Anyway, they have a very finite amount of time to respond and say, yes, I want this money and here's my information. No, or no, I don't want this money. Or they can just ghost the whole situation. But the point is, we don't have to wait forever while they ghost the situation. There's a time frame. Okay. And then the last piece. So Kara mentioned, in fact, talked quite extensively about the Build Back Better Act or reconciliation. And I just want to highlight, there are so many good things, necessary things in this legislation to help Kentuckians and Americans thrive. These are not negotiable. They are things that we need and deserve. And one of those things is an investment in our affordable housing infrastructure and programs, because part of the reason this pandemic has been so awful and painful for people who were housing insecure is because our housing system was completely broken prior to the pandemic. And so this Build Back Better Act, with the 3.5 trillion over 10 years, just not that much money, over 10 years, would include a significant expansion of rental assistance that would have a great impact on Kentuckians. And it includes money to actually build and preserve and rehab homes for people at 30% or below of the area median income. These are our housing insecure folks. These are the people who cannot afford market rate housing. These are the people who get blamed because they cannot afford market rate housing. And so we know that prior to the pandemic, we were short 78,000 homes for our Kentuckians in this income range. We know that we have to add homes. We need to bridge the gap using vouchers, but we also have to add the supply. So I would challenge everyone, if you represent an organization and you have not signed on to this letter at this link, do it. Just do it. There are 23 organizations from Kentucky. And in the meantime, there are like 250 from California. California takes up like 2 pages. I would like us to take up at least 1 column, okay? Next slide, and I think I can hand it over. All right, Tyler.
Hello all, Tyler Offerman here with the Kentucky Equal Justice Center. Gonna take a walk down the food and feeding lane here, talk a little bit about SNAP and PBT and a couple other things. Before we get into the minutia, just sort of big picture when it comes to SNAP especially. So this is a graph that shows SNAP enrollment dating back to 2006. So that allows you to kind of see the, excuse me, Great Recession all the way up until our present moment. A couple things of note, the weird little squiggly lines there around 2016, 2018, that was the Matt Bevin administration passing very draconian and restrictive policies that prevented folks who had previously been eligible for SNAP from participating in the program. You'll see the line then jumps up, but not quite to the post-recession levels. The data is a little bit hard to parse in that, you know, the Bashir administration lined up with the pandemic. So it's hard to know if the big increase in SNAP participation was because of the switch in administrations and policies, or the pandemic, likely a combination of all, but just big picture, about 556,000 folks currently enrolled in the program. That looks like, in dollar and cents amount, $127.2 million brought into the state of Kentucky, mostly into farmers markets and grocers in the month of August. And the participation rates vary widely from county to county, depending on how wealthy they are, obviously, how much wealth is in the county. Oldham County at 2.2%, to Owsley County at 36.6%. So that's of the population in that county, how many folks are participating in the program. So yeah, a lot of folks are struggling, even more so because of the pandemic. So let's talk a little bit about some of the changes. Next slide. Oh, and then I also meant to say on the last slide, obviously, please be encouraging people to apply, especially in light of Dustin's comments around unemployment insurance. A lot of people just lost access to a lot of those programs, and that may have been putting them over income to participate in SNAP. So those folks might be eligible now. Make sure to encourage your folks to apply if they were denied because of their unemployment before. So just some big top level updates. So emergency allotments, sometimes called max allotments in SNAP, have been approved for October. Those are still done on a month-by-month basis based on the state of emergency and federal states of emergency in regards to the pandemic. But the unfortunate special session that was mentioned earlier, one of the positive things is that they did extend the state of emergency until January 15th, which means that as long as there's a federal state of emergency also, we should be getting emergency allotments through the end of the year without too much drama, nail biting. So that's good. Some folks may have noticed a change in their benefit levels moving from September into October. That's because a temporary program in response to the pandemic transitioned into a permanent program that was recently reviewed as a part of the USDA's Just Farm Bill regular process of analyzing how much does food cost. So the 15% went away, and the changes to the Thrifty Food Plan, which is that base calculation for how much should a meal cost a family, quote, on a thrifty budget. So folks should have seen a small but important increase of about 3 to 8%. But the good thing about it is that folks would have seen a massive decrease in benefits because of the 15% going away if the Thrifty Food Plan hadn't been updated in time. So folks should have seen a small increase, but that increase is really important and would mark the first time since I've been alive that the USDA has actually updated that calculation. So that's good. A couple things have changed in price since the mid 80s. Another thing, just to remind folks, public charge is gone, even though it realistically impacted very few undocumented or non-citizen residents in Kentucky, scared a whole lot of people. So just remember to spread the word, public charge is no more. And then the temporary waiving of the work requirements for college students is still in effect. Hopefully we can get that extended permanently. And then just a note there, as far as recertifications, they were stopped for a little bit during the pandemic. They have restarted, and there's just the ways that you can go about updating your information and recertifying. All right, so next slide, please. Great, and this is just explaining what I said earlier. It's a graphic that you'll just have in perpetuity that explains the phasing out of the 15% and the phasing in of the Thrifty Food Plan. So next slide. PBT. Folks may remember this program, very popular. The programs that folks had been receiving money from, we've been doing regular updates about, you'll get this month, it was due back then, where they're catching up because it took so long to approve. So all the payments from past due PBT and the summer EBT program, PBT was during the school year, summer EBT was obviously just for the summer. All those monies should have gone out. If you did not receive those monies, you need to call DCBS, the number on the first slide I had, and look into what's going on and find some answers there, because all that money has been sent out. And Kelly, if you want to hit enter. If we pass that big old bill that was mentioned earlier, that contains a whole bunch of positive things for our communities and economies, the summer EBT program would become permanent. Currently, next summer, it would not happen without the passage of that bill. So that would be real nice. All right. And folks might be asking, what's going on in the future? I don't know. There was some complicating factors from the Fast and Furious special session that we talked about earlier. The passage of Senate Bill 1 and the eventual overturning of the governor's veto on it, the way that they calculated those virtual non-NTI, NTI days, well, the cabinet still needs to interpret it and get guidance from the USDA once we submit our plan. But at least in folks that I've talked to who are much smarter than me, it would appear that because staff still has to physically go to the school for those non-NTI virtual days, it's still an in-person instruction day. And to qualify for PEBT, the child needs to be not present, and it needs to be a non-in-person instructional day. And it's a little confusing to me, and we still need to work out the details, but the problem with working out the details is that it's going to take time. And the PBT process, where we have to go back and forth with the USDA, already took a really long time. So this is only going to add to that delay. And unfortunately, that's the best update that I have on PBT. We hope to get guidance. Originally, the optimistic plan before the legislature passed Senate Bill 1 was that we would be able to hopefully, if the stars aligned, get the plan approved by the end of this month. I just don't see that happening. And I don't have a firm date that I can give to this group. Obviously, we will as soon as we have one. But if you want to hit enter one more time. Last note, because the guidance is up in the air, we were in a similar situation before where it's, do I keep my card? Don't I? We don't know. But best case is that they do reissue benefits onto those cards that folks already have. So please do save them. You might have multiple cards from multiple bouts of PBT. If you need to put a sticky note on them, keep them separated or something, but keep the last one you got. Hopefully benefits will be going on to that in the future. And that's the best I got. Hand it back over.
Thanks, Tyler. So hi, I'm Priscilla Easterling with Kentucky Voices for Health, and I'll be doing the health updates today. So just a couple of reminders. The current public health state of emergency is in effect until October 17th. Now, we do expect that to be extended through the end of the year. Just a reminder, the Biden administration did give states a promise that they would give a 60-day heads up before they ended the PHE. So we do expect that to be extended through January, and we should hear about that in the next 2 weeks. Medicaid SB 55, which went into effect at the end of June, permanently prohibits any form of cost sharing, including copays and Medicaid and K-CHIP. So if you are paying any copays whatsoever, you should not be a thing. And just a friendly reminder that there are no out-of-pocket costs for COVID-19 vaccines, whether you're insured or uninsured. So if you haven't gotten your shots yet, definitely check out this vaccine appointment checklist and go get vaccinated. The pandemic is still very real. We still need people to get vaccinated. Next slide. So some of the insurance coverage for COVID-19 testing has changed a lot over the last 18 months. Since vaccines have rolled out, a lot of insurance companies have moved to only covering what they deem medically necessary tests. And now these tests, it only falls into medically necessary if you're experiencing symptoms, if you've been exposed to someone with a positive COVID-19 test, or if a medical professional has referred you for a test. So if any of those things are true, your test should be covered by your insurance company. And if you have any problems with that, you can file a complaint with DOI. One of the best options, though, are still some free testing sites that are available throughout the state. There are community testing sites that are listed on the Team Kentucky website that I've linked here. But one of the other things that the state has done, if you can go to the next slide, Kelly. So on September 23rd, the Kentucky Department of Insurance issued guidance to all insurers, encouraging them to waive all cost sharing, including copays and coinsurance, for all COVID testing, regardless of network participation. It also encourages them to waive all prior authorizations or any medical management requirements. And that should go through the end of the state of emergency, which the General Assembly during the special session extended to January 15th, 2022. One of the things that they also did was support this move by the Department of Insurance. It was part of Bashir's executive order, and so they supported that. And so this is encouraging to all insurers, but if you do have any problems with your insurer not covering your COVID testing, or if you think that it should be, definitely file a complaint with DOI. For Medicaid, that should not be an issue. CMS has reminded state health officials and MCOs that ARPA requires Medicaid and CHIP to cover all COVID-19 testing without any cost sharing, and that began March 11th and will extend about a year beyond the end of the PHE. Next slide, please. So, other exciting news, it's open enrollment season. So Medicaid open enrollment starts October 15th and will run through December 1st. That's available on connect.ky.gov. Now, this is an opportunity for people who are already enrolled in Medicaid to change and compare their MCOs, look at what the other opportunities and offers are. And you can always apply for Medicaid, but during open enrollment, that's the time, if you're already enrolled, that you can change your MCO. Medicare open enrollment also sort of lines up. That's October 15th through December 7th. You can apply on medicare.gov, and you should make sure to check your mail for that annual notice of changes. That is a requirement that they let you know any updates about changes to your coverage, costs, or service areas. And then last, the health insurance marketplace, or the state-based marketplace, which will be on Connect this year, starting November 1st. That will run through January 15th. That'll give you an opportunity to shop and compare plans on connect.ky.gov. If you're eligible for a special enrollment period, or if you need to enroll in a marketplace plan before November 1st, you do still have to go through healthcare.gov. But as of November 1st and moving forward, that will all be available on Connect. And as of September 17th, healthcare.gov automatically sent all of their current enrollees information to Connect, so that they already have that. From September 17th after, there will be a little bit of a delay in sending that information, but they will also send that over. So you don't have to worry about that. Next slide, please. Okay, and so here's an updated comparison chart for the 2022 MCO extra benefits. So it shows all of our available MCOs in Kentucky: Aetna, Anthem, Humana, Passport, United Healthcare, and WellCare. All of this is linked. It is worth checking out because each MCO offers a lot of different value-added benefits, and it's definitely worth comparing and shopping around for what's going to be best for you and your family. Next slide. Okay, and so the like I mentioned, the state-based marketplace open enrollment, what was healthcare.gov, will now be Connect, and that runs November 1st through January 15th. For 2022, the state was able to add 2 more insurers to Kentucky. So in 2021, it was just Anthem or CareSource, sorry. But for 2022, we added Molina and WellCare. So that'll offer a couple more opportunities, a bunch of different plans to help compare and find something that would work best for you and your family. Next slide, please. So a couple of just updates about the special enrollment period from this past year that ran on healthcare.gov from February 15th through August 15th. During the special enrollment period, there were 20,000, almost 21,000 brand new plan selections. That is up from 2020 and 2019. And that's because it was an open special enrollment period. Typically, you have to qualify, you have to have some sort of life change, but because the Biden administration opened it up, everyone was able to go through it. And so in Kentucky, there were 20,000, a little over almost 21,000 brand new plan selections during this special enrollment period. There were 40,000 updated or new plan selections since March 31st, and that is when those ARPA increased subsidies went into effect. So around that time is when a lot of people got to see those savings go into effect right then. So ARPA did reduce premiums by 48%, saving Kentuckians an average of $75 a month. And that's a total of over $3 million in premium savings for Kentucky households. That's a lot. ARPA did a lot of great stuff. For any Kentuckians who did not go back and update their application, if you were already enrolled in healthcare.gov, you didn't go back and update your application during that special enrollment period on September 1st, healthcare.gov automatically reduced those premiums and put those increased ARPA increased ARPA subsidies into effect. So that applies to about 36,000 Kentuckians, and that's an additional 1.9 million in savings that's expected. And then just nationwide, 2.8 million people enrolled during the special enrollment period, which is just awesome. And around 587 million was saved on premiums just because of those ARPA increased subsidies. And then I think is just really cool, the median, can't even see it. The median deductible for plans moved from drop more than 90% from $750 to just $50, which I think is fantastic. Just ARPA did a lot of great things and saved people actual money every month. So next slide. And this is just a chart sort of showing you the comparison. So you can see a little bit better of that breakdown based on your income, based on people's income, how much should they save, how much would they have paid beforehand and versus after ARPA. New enrollees did save an average of around 25% and current enrollees saved around 40%. But again, that is a little bit higher once we look at effectuated enrollment. People did save a little bit more. Next slide, Kelly. Okay, and so as I mentioned in our previous webinars, there was a premium assist. There was 100% premium assistance for COBRA eligible employees, and that ran from April 1st through September 30th. That did end last week. So the end of that subsidy period, though, is actually a special enrollment period. So if you were on COBRA, you had that premium assistance, that premium assistance ended, you can now go through the marketplace and you're eligible for a special enrollment period. And you just need to access healthcare.gov to be able to shop for that, shop for those plans and compare. And you do that before the October 31st. If you do it after that, then you would go to Connect, and that's part of open enrollment. If you have any questions or if you've had any problems with that, definitely feel free to reach out to me. That's my email, and happy to help with that. Next slide. And then just a friendly evergreen reminder, PE is available. Kentucky allows 2 PE periods within a calendar year. It does cover 2 months of coverage at this point. So it's the month of your application plus the following month. You can apply for PE anytime throughout the year if you're uninsured, under 65, or if your income is at or below that 138% FPL. So that's going to be $17,609 roughly for an individual, around $36,000 for a family of 4. It's still being managed by United Healthcare, and currently around 20 to 30,000 Kentuckians are covered by PE. It is not being automatically extended like it was earlier in this year, but the application, at least as far as we know, will remain publicly available at the link that I've provided there. And I think that is it. So I'll pass it on to Marcy. If you have any questions, I'll be in the chat.
Thanks, Priscilla. So much good information in this webinar. I know everybody needs a second to catch up. Welcome to this little section called Mental Illness Awareness Week. We are talking about a little bit about grief, a little bit of stress, and a little bit about behavioral health. I am Marcy Timmerman. I'm the Executive Director of Mental Health America of Kentucky. One of the big points today to walk away from my section is to know that a lot of people have invisible issues going on right now. And it's not just because of COVID, that always exists, right? But it is Mental Illness Awareness Week, and we want to talk about those invisible illnesses a little bit. Thanks for changing the slide, Kelly. I forgot to ask you to. Thank you. So 1 in 5 US adults experience a mental illness every single year. So that's on a rolling basis. 1 in 20 experiences severe mental illness each year. And so there's a lot of people on this call. There's more than one of you having some severe issues and definitely some mental illness signs. So just know that that's always out there in a big group, especially. Just assume that that's the case. 50% of all lifetime mental illness begins by age 14. And yes, teenage angst is a part of that, but illness is a little bit extra, right? And we have some great clinical tools to help us know that. 75% of issues, though, begin by age 24. So if you know any youth ages, anywhere as young as 8, I have people taking mental health screenings with us, and as old as 25. It's really where you got to watch those early signs and symptoms. So pay attention this week to social media. You'll be hearing a lot about mental illness this week. Next slide, please. So I wanted to make sure we brought in grief because I feel like with the uptick in COVID deaths, people are experiencing a lot more grief again. But it's important to note that grief is not only with a loss or a death of a person, it can also be the loss of your stability. So maybe your job, maybe a loss of routine, things like that. You're going to go through some of the grief stages with any kind of loss. Loss of a pet, another issue that's been happening a lot in my circle. So I wanted to bring up the 5 stages of grief briefly, and just so we know, they don't always work in a line like this, right? They can happen in any order. Denial, anger, bargaining, which means you can also feel overwhelmed. I think people don't realize that that's part of the bargaining discussion. Depression, right? Struggling to find meaning. So it may not be clinical depression, right? It's a moment of depression. And acceptance, looking for new plans, moving on, but then maybe you feel guilty about that. So you go back and forth through different things. So just kind of keep in mind that these kinds of feelings are very normal. Take a look at this slide if you need to screenshot it or take it wherever. You can look at the 5 stages anywhere. I really liked the Kubler-Ross model because it does have some other words affiliated with it. So because I don't think we always think of anger as frustration, right? For instance. So just keep this in mind as you're experiencing a lot of big feelings right now. We're all feeling losses of different things, right? Loss of everyday life that we had before COVID is a community loss. So keep thinking of that as you go through things. Next slide, please. And a quote that Sheila Schuster sent me, that is a really good quote, I think, about grief. When you do lose somebody, including a pet, the reality is you're going to grieve forever, right? We don't get over grief. So you don't get over the loss of a loved one. You learn to live with it. And a lot of people do learn to live with it. And that varying time though, right? There's no timeline on it. You will heal though. You will rebuild yourself around the loss you've suffered. You will be whole again. You'll never be the same, and you don't want to be, right? You want to remember whatever it is you're grieving. So whomever. So just wanted to kind of stick with that for a minute. Go ahead and change the slide, Kelly. Thank you. And just switch quickly from grief to self-care. Any of you who've been on these, this is a slide we have every time. But I really think it's important to remember that even if you're grieving, self-care is important, and these are important every day, right? We need to find opportunities to laugh, whatever those might be. Get enough sleep. Exercise as appropriate, and I always say I love that way that they phrase this from mental health first aid. Appropriate for you, right? Whatever works for you. Don't over-exercise, but do what you can. Set healthy boundaries on your time, on your life, on where you're going to spend your time. Be kind to yourself and stay connected with loved ones as much as you can. So if social media is the way you do that and it was down yesterday, find another way. Make sure you have other ways to connect with people that are really supportive of you. Right, next slide, please. Yep. Just a quick plug. It is Mental Illness Awareness Week, right? And in case you are concerned about your own mental health right now, you would not be alone. We have over 11,000 people have taken screening since January. And that's a number from June 30th. So I promise you more than that have taken our screenings. Go to mhascreening.org. The link is live in the PowerPoint as well when you get it. So just take a look. We are seeing increasing severity with anxiety, depression, loneliness, relationships, and past traumas are the reason people come to take our screenings. So let's make sure that if those things are in your life, it's a good thing to take our screening. Just see how things are falling, right? And we have a lot of DIY tools at the end of the screening to help you kind of rethink yourself and think through things. So, next slide. And then we wanted to make sure we covered suicide prevention because suicides are up right now. We are losing a lot of healthcare workers and teachers and other folks. So we want to make sure we had this information in here. If you or someone you know is thinking about killing themselves, please have them call 1-800-273-TALK. They can call before they're in that situation if they need help as well. And they can also reach out to me at our Get Help page, or just to call me. You all will have my contact information if it's before that. The crisis text line for people who hate phone calls or don't have phone minutes, right? 741-741 is an excellent resource. For our LGBTQ community, the Trevor Project has multiple ways to reach them. Really approve of that. So wanted to make sure we all had that as well. I don't put the Trans Lifeline on right now because they're going through some transition and their hours change. They're not a 24/7 right now. So that is out there if someone needs a short-term answer. Next slide, please. And now it's up to Beth.
Thank you, Marcy. Good afternoon. As Marcy mentioned, my name is Beth Workman, and I am a senior program specialist with the Kentucky Coalition Against Domestic Violence. We are a statewide coalition serving 15 domestic violence programs across the area development districts. October is our Domestic Violence Awareness Month, and KCADV has many ways to connect. Unfortunately, Kentucky has one of the highest rates of domestic violence in the nation. And there are a few ways you can get involved this month. First, there's the governor's press conference on October 18th at 11 a.m. Eastern Time called Towards a Violence-Free Kentucky, KCADV's 40th anniversary virtual panel discussion. You can find the press conference on the governor's YouTube channel, and also we will have ways to connect to it through our social media. Speak by Name is how we remember the lives lost to domestic violence in Kentucky. There will be a special presentation during our press conference. KCADV is in the midst of conducting our own year-long needs assessment. Resources and what we do in detail is included on our website. You can visit www.kcadv.org for additional information. You can also follow us on Twitter and Facebook to connect. Search for Kentucky Coalition Against Domestic Violence on your preferred social media platform to find us. Next slide, please, Kelly. KCADV is conducting a needs assessment to understand the needs of domestic violence survivors throughout Kentucky. We are interested in how DV survivors' access to a variety of resources affects their ability to live safe and healthy lives, what resources they would like to see for survivors in their communities, and how survivors would like to access support and support services. If you work for an organization that provides services to survivors of domestic violence, you can help us recruit participants, and we'd love your assistance. You can reach out to our research team at kcadv.responses@gmail.com, and I can put this in our chat box. There are 4 opportunities to participate via survey, focus group, individual interviews, and community asset mapping project. Survivors who participate in the interview, focus group, and/or surveys will receive $20 for each engagement. You can find out more information by visiting the website on this slide. And just a reminder to please remember to contact your representatives and encourage them to pass the Build Back Better legislation. With that, I'm finished. Thank you. Next slide. I will pass it on to Emily from Kentucky Voices for Health.
Thank you, Beth. I just want to give a shout out to all of our speakers today because we have an extra speaker on and we're still under our time limit, which is fantastic. We don't always manage that. So I am going to very quickly share a few resources with you. The first is actually an updated resource that we've talked about before on past webinars. So this is the 6 ways that the American Rescue Plan Act helps Kentuckians. And of course, you've heard all of those ways throughout this webinar. We talked about, the extra subsidies, the savings people get on the marketplace, the housing assistance, the child tax credits, the additional food assistance. But this is a great way to share that information with other Kentuckians and people in your network. So we have 1-pagers in English and Spanish, that's front and back, to show you just a little bit of information about what each of those ways, those types of benefits and how you can get them. And then we have the frequently asked questions, the updated FAQs in English and Spanish. And this has more recent information than I believe the last time that we had a webinar. And we've just especially updated sections on the child tax credits. Well, actually, maybe every section got updated. So take a look at those and make sure that you're sharing them with your networks and using them if you are working with people who directly need that type of assistance. And then these are resources that we share on every call, but I think that they've been updated this time, and it's really just meant to be an archive so that you can go here to the back of our slide deck and make sure that you have all of the resources that were discussed as we were going through our different sections. So you have housing and utility assistance resources here. We have links to many other resource guides, the temporary Medicaid application, which we call presumptive eligibility, resources that are available through Connect, United Way. These are all of the legal aid programs for different regions of the state. And here we have some food assistance resources. We have a Medicaid tracker if you're interested in just keeping kind of a finger on what's happening with Medicaid enrollment in particular and the reasons that people sometimes lose their Medicaid. A SNAP tracker and a COVID-19 tracker that our friends at the Kentucky Center for Economic Policy keep updated. And these are fantastic if you are looking for information. And then just a reminder, we do have a story banking project going on, Homeless and Housing Coalition, as well as Kentucky Voices for Health. And so if you are interested or know someone who may want to tell their story, you can contact Katie Mueller. Finally, we have some dates here for our next Thrive state and federal policy update, which will be in December. And then our forum with the Cabinet for Health and Family Services will be this coming month in November on the 2nd at 2 p.m. And We also like to just remind people that we have an Advocacy 101 training with Dr. Sheila Schuster. This was recorded last year, but it really is evergreen. It's something that I've watched probably many times, or I've seen Dr. Schuster give the training many times, and I always learn something new. She and I will actually be providing this training or a version of this for community health workers on Thursday. So if you're a CHW and you have been registered for the annual conference, be sure to join us on Thursday at 10 a.m. And just another reminder about CEUs, I also want to remind you that we will be sending out the recording and all these materials in a follow-up email tomorrow, along with an evaluation. And we really would like your input on what you'd like to hear and, you know, our upcoming webinars, and especially our next forum with the Cabinet for Health and Family Services. So please do take a minute to give us your thoughts. And with that, I'm going to take a quick look at the chat to make sure that there aren't any questions that we haven't covered. I don't think so. We do have a couple more minutes if anyone has something last minute that they want to ask. Otherwise, we can wrap up a few minutes early. All right, well, I hope everyone has a good fall break, and we will see you in November. Thanks very much.